Okay, wonderful. Thank you so much for joining us for today's webinar. I want to welcome you to this IARS virtual education webinar, which is co-sponsored by the Early Stage Anesthesiology Scholars. Our webinar today, which is titled Women in Physician Scientists and Clinical Leadership Roles in Anesthesiology and Critical Care, Pathways, Barriers, and the Role of Sponsorship, explores an extremely important topic to address a diversifying workforce in academic medicine and in our field. And I'm so grateful to our inspiring panelists for being here today. This webinar has received no commercial support. And we will start with a few IRS announcements. If you missed the 2025 annual meeting, there are on-demand recordings available for purchase, but registered attendees will have complimentary access. And for more information, you can visit the link that I'm showing here on the screen. The 2026 annual meeting will take place in Montreal, Canada. So please save the date. Abstract submissions are now open and the deadline to submit is December 7th. Please visit meetings@iars.org for more information about that. The new IARS Career Center has also launched. This is a place where you can access jobs, candidates, and resources if you are taking your next career steps or trying to recruit to fill a position. And for upcoming webinars, you can visit iars.org/CME/webinars to register. Some of those webinars are listed here. And then finally, for this webinar, please just submit your questions via the Q&A button below. We'll have time for dedicated questions from the audience at the end of our panelists' interviews. So again, it's my honor to present an inspiring panel of academic leaders to speak on this very important topic. I'm your moderator. My name is Sylvia Ranjeva. I'm an anesthesiologist and intensivist at Beth Israel Deaconess Medical Center in Boston, and I'm an early career physician scientist. Our panel includes Dr. Beverley Orser from the University of Toronto in Ontario, Canada, Dr. Kimberly Rengel from Vanderbilt University in Tennessee, Dr. Rebecca Minehart from Brown University Health Sciences in Rhode Island, and Dr. Katarina Ruscic from Massachusetts General Hospital in Boston. I will introduce your panelists in depth as we proceed to their one-on-one Q&A. So we'll begin with some historical context and evidence from the literature to frame the issue of gender disparities in academic anesthesiology. The last several decades have seen a steady increase in the number of junior female physicians and trainees, largely due to proactive efforts at the level of medical education. However, women remain significantly underrepresented at higher levels of medical and academic leadership, and there's dramatic attrition of female physician scientists at later stages of the academic pipeline. And so while women represent the majority of junior clinical instructors across academic institutions and across fields, they represent a disproportionately lower percent overall of full professors and members of senior leadership across academic specialties. When it comes specifically to research funding, only 30% of R1 equivalent NIH grants are awarded to women across scientific specialties, making it more challenging for women to sustain an independent research career. And as a result, with this attrition at the mid-career level for female physician scientists, there's then a paucity of female mentorship among senior faculty, which disadvantages the next generation of early career investigators. And so the fundamental question becomes, what accounts for this, and how can women overcome structural barriers to advance in academic medicine and to create a precedent of leaders to serve as mentors to younger investigators? Unfortunately, this issue affects anesthesiology and procedural subspecialties disproportionately compared to other fields. Across the board, women in anesthesiology experience income disparity and lack of access to early and mid-career funding compared to male counterparts. Furthermore, women represent only 21% of full professors across academic departments, and the growth in female full professors over the last decade has lagged in anesthesiology compared to other specialties. So a body of work pioneered by some of the women, in fact, on this panel, has addressed the root and solutions to gender disparities in academic anesthesiology. Key determinants of success for women in academic anesthesiology have been studied in both qualitative and quantitative approaches, and a 2023 national survey of high-ranking women across academic departments identified several key motifs leading to early and mid-career success. The first was the importance of sponsorship or advocacy by senior women to advance the careers of junior faculty. Sponsorship goes beyond mentorship to involve active promotion and active advancement of junior counterparts. Other key determinants of success from this survey included aspects of leadership acquisition, such as early mentorship and self-promotion. And for many women, it can be particularly challenging to identify and advocate for our strengths. And I was, particularly inspired by this anonymous quote from the survey, which is an example of a female leader really advocating in a confident way for promotion. The study also identified 2 personality traits, adaptability and perseverance, that are common among senior female leaders in academic anesthesiology and female researchers across the board in science. So each of our panelists is really a prime example of these determinants of success. Each panelist will be kind enough to share in her own words her journey and career path, and I'll ask a few directed questions about some of the issues that we've highlighted. Then at the end, there will be time for general Q&A from any of our panelists from the audience. Our first panelist is Dr. Beverley Orser. Dr. Orser is the chair of the Department of Anesthesiology and Pain Medicine at the University of Toronto, as well as an active anesthesiologist at Sunnybrook Health Sciences in Toronto, Canada. As a clinician, she has a longstanding interest in patient safety and has co-founded the Canadian Perioperative Brain Health Centre, as well as the Patient Safety Committee of the Canadian Anesthesiologist Society. She is an international leader in the field of academic anesthesiology and served as the chair of IARS. Dr. Orser's preclinical research focuses on mechanisms of action of anesthetic drugs. She, in fact, discovered the unique pharmacologic properties of extrasynaptic GABA A receptors and pioneered the study of GABA A receptors as novel drug targets. As a scientist, she has published over 200 publications and has mentored a generation of translational neuroscientists and physician scientists. She's received many distinguished awards. She is a member of the National Academy of Sciences in the United States and the Canadian Academy of Health Science. In her outside life, she is a devoted mother and grandmother, a passionate triathlon enthusiast, and loves spending time outdoors. We are so lucky because Dr. Orser has also published significantly on the topic of gender equality in academic anesthesiology. So Dr. Orser, I will stop sharing here to invite you to share in your own words about your career journey and your experiences as a woman in academic anesthesiology.
Well, thank you very much to the IRS and to you, Dr. Ranjeva, and the team for putting this session on. It's a really important topic, and I'm really delighted to be here. So cut me off when you need to move on. I wanted to begin by saying my path was anything but linear. I wasn't expected to be where I am right now at all. I did 2 years of undergrad, went straight into medicine, and then did a rotating internship and decided I want to work in the far north in Canada, remote regions. I went back and trained as a family physician anesthetist and worked out in very rural communities, and then also worked in the West Indies. I managed the pediatric wards in a hospital in St. Lucia, and then decided to come back after I had worked in community to an academic career and finish residency. During residency, I became interested in research and then undertook a master's PhD and then carried on with my neuroscience. But I mention this just to say there is no single straight path to an academic career. The other piece I want to mention is that I really didn't expect to find myself even in medicine, because in grade 8, I've noted this in written work, I failed grade 8. There you go. I put it out there. It's because I moved to a community that I didn't speak the language. I was perhaps a bit rebellious. I did not work hard enough. And I couldn't keep up because I didn't speak the language. Fortunately, I didn't lose my year because I went to summer school. But then when I moved back to a community where I could speak the language, I was able to catch up and get into the university I want. So the lesson there is the importance of environment. And where you find yourself as you move forward, you have to be aware of that and choose your friends and choose your environment carefully. And then I just worked away and found a research area that really spoke to me, that excited me. And I found people that shared my passion and enthusiasm. And I think in terms of leadership, the journey was really just pursuing the things I loved and finding people that I like to work with and share my time and experience with, the IARS, for example, being one of those. And I'll come back to that later. But just to say, I just followed my passion, looked for people I wanted to work with, those that I admired, those who I could learn from, and just kept pushing forward. It was a slow climb because I have 3 kids, now 3 grandkids, and I was okay with that. I realized my career was going to go slower than most, and I certainly accepted it and was unapologetic about it. You do have to be determined. You do have to be a bit edgy and sassy and just know that you have a place and don't internalize those voices that say you don't. So I think I'm happy to answer questions, but maybe I'll leave it at that.
Thank you so much. You've highlighted some really important themes of just authenticity, as well as the importance of environment and identifying people that you resonate with. I'm wondering if you can identify key examples along your career trajectory of either sponsorship or early mentorship that played a pivotal role for you.
Yeah, well, I remember in, I think it was grade 10, where a female chemistry prof handed me back my marks, and they were pretty good. She was surprised and I was surprised. I thought, okay, I can do this. Okay, maybe I'll get serious about my academics. That was a turning point. And then I met along the road people that simply loved the work that I loved, and were indifferent to the fact that I was a woman, and that wasn't a barrier. There are barriers. Let's just put it out there. And it's death by 1,000 cuts. And when you kind of get that feeling like, oh, why am I being treated that way? You know what it is, but recognize it, right? And I think the big thing is, don't try and change the minds of people who don't think they have a problem. You zig and you zag, and you go find those people that are going to help you. And so I had a very wonderful research mentor, John McDonald. We spent many years together pursuing glutamate receptors and NMDA receptors, and just really enjoying our science together. And so finding a few people like that can be absolutely pivotal in one's career.
Thank you so much. I really appreciate your comment on sort of adaptability, because you're right that so often it is, in fact, sort of a microaggression that, these barriers that pile up in sort of an insidious way, and how do we just adapt and keep focused on the positive. And I really appreciate your example of identifying a positive mentor that sort of helped you in your journey to, create that adaptability. I'm wondering, when you think about the beginning of the early career pathway, what advice do you have for aspiring female physician scientists who are looking to really start that journey? And how can early career female investigators advocate for themselves in an effective way?
So, if you want to be a leader, you have to act like one. You have to jump in, you have to contribute, you have to volunteer, look for opportunities, but do stuff, like be impactful, contribute. And it's helpful to have coaches and sponsors, but really the best way is to work alongside people. Be helpful to them, identify shared goals. And that's the best way to get their time and help. And I know you're going to ask me about organized professional organizations. Well, these organizations, if you have shared goals, you're working side by side with some of the best minds in the world. And watch what they do, watch their professionalism, watch how they manage mistakes. How do they manage conflict? That's where you learn, by rolling up your sleeves, contributing as you can in the time and space you have, and just watching around you. That's mentorship. And that's actually far more impactful than having someone sit down with you over a cup of coffee. It's really seeing them in action, and they will support you as you go along. So I like the sort of active model of mentoring and having people participate and work towards shared goals, because I think that's much more genuine and productive for both the mentee and the mentor.
Thank you. And yeah, I would be so interested if you would expand a little bit on your journey towards involvement at such a high level with IARS. I know that, professional networks have been identified similarly in some of these studies as just really important structural factors for success for female physician scientists.
Thank you for asking that, because I didn't really appreciate the importance of professional organizations till late in my career, and boy, are they important. They obviously advance the specialty, they advance the science, but they also advance the people who are committed to them, and certainly participating in the IRS was absolutely one of the highlights of my career, because I was working with wonderful people, like the best in the world, to be sitting having dinner, arguing about programming and this and that and what our priorities should be. And that was just absolutely thrilling. That said, you need to do that work at the right time in your life and career. When I had a young family and was also running the lab, man, I was the first one to be looking for the first flight home. I was the runaway bride. They used to laugh at me. I was the first one on the Air Canada app figuring out how I could get 6 hours, back at home. And so your time to make these contributions, you have to pace it and do what you can, accept that you're not going to be able to do them, and tailor them for you, your family, your needs, and your career. For me, it was later in life when I could do it, and then I was able to enjoy it. I'd been asked and I thought about it early on, but I just said, no, it's just not a priority that's going to work for me. You do have to think carefully about your priorities and sort them out so that you don't feel pulled in 100 directions. That is, often we want to please, we want to, there's, the deal, but you really do need to be very intentional about what you're doing and try and define for yourself your goals and stick with it.
Thank you so much. I really appreciate that message, because I think the idea of pacing yourself and allowing things to develop organically is not something that in the early stages of this career we hear amidst kind of the pressure of funding cycles. So that's a really important point. I'll finish with two questions for you. The first being, what do you think are the most important structural factors at either the departmental level or the individual level from higher leadership to prevent attrition of women at early stages of the career in academic anesthesiology?
Another great question. There are real structural barriers. And, I saw your 50% entry of women in anesthesiology. In Canada, we sit at 30. So we're starting behind the 8 ball, and then we see the drop off. So maybe I'm not the one to advise this group, but if you can't see it, you can't be it. So it's very important that you have representation at all levels, including senior levels on your panels. And you have to be intentional about it, because it's not going to happen by accident. We are not going to see things change unless there's real intent in terms of tracking what's going on. And that means data and evidence-based decision making and collecting information so you can show it to the partnerships. This is where we sit. This is where the national average is. We need to think about this and reflect about how this is impacting. And the data is very strong that diverse groups are far more effective and far more impactful. And even late in my career, that's sinking in. We need this diversity to all be better. And so if that's lacking, then a group needs a discussion to say, what are those barriers? And we've climbed out of COVID. We've got to start addressing these issues more and more. And even at the University of Toronto, where we're very mindful of it, we're still very actively working to try and reflect parity with other specialties. Anesthesiology is behind for sure. And I think part of that is hours, unpredictability, that late night stuff. And so there's probably ways of being more flexible and trying to understand how we can build that flexibility. And so we do have the benefit of diversity and so we have the benefit of diversity.
Thank you so much. The last question that I'll ask you, Dr. Orser, from your body of experience is for mid-career and established female physician scientists that are looking to support women coming up the pipeline. Do you have any specific guidance or pearls of wisdom that you find most impactful?
I think try and lead by example is the first one. And if your capacity allows you put yourself out there to participate in discussions and meetings and seminars. I've been very impressed at how effective the coffee chats are, even the IRS coffee chat. It was like so fun and so amazing. And that can be done locally. And I know our Lisa Isaac, who's on our faculty, organize similar events, and they do resonate. And of course, one-on-one conversations. We'd like to have lots of them, but we're all pretty stretched. Those group activities are also very, very impactful. So I think being intentional about tracking the numbers, looking at who's sitting on the panels, who select, trying to reflect what's happening across the country, and then looking for opportunities to have a group conversation just like this, I think is very helpful. And I'm sure the panelists have many good ideas on this topic.
Thank you so much. Thank you so much for sharing your journey.
My
I
pleasure.
will go ahead and share an introduction to our next panelist. Dr. Kimberly Rengel is an assistant professor of anesthesiology in the Department of Anesthesiology and the Division of Critical Care Medicine at Vanderbilt University Medical Center. She is an NIH-funded researcher and the director of the Resident Scar Lily Activity and Research Program for her department. She also serves as the medical director of the High-Risk Surgical Encounter Preoperative Optimization Clinic. Dr. Rengel's research focuses on evaluating mechanisms, prevention strategies, and potential therapies to mitigate acquired disability after critical illness, particularly in older adults. She has received multiple sources of independent funding at the institutional and federal level, multiple distinguished awards, including the 2018 Vice Chair's Award for Outstanding Scholarship at Vanderbilt. And Dr. Rengel has also served as the co-president of FCAHS. In her outside life, she is a devoted wife and a mother of two, which soon to be three. And she is also developing an expanding interest in running and just ran her first Spartan 5K race. So Dr. Rengel, with that context in mind, I will invite you to share about your journey in your own words.
Thank you very much, both for the kind introduction and for including me on this amazing panel today. It's really an honor to be here and to be able to talk about this very important topic to me, and of course, nationally and internationally for all of our colleagues. My journey into academic anesthesia was what I would have also called a little bit non-traditional. I had always had this sort of background interest in research and understanding how more complex diseases worked, or how you could use research as a way to provide a broader impact in an area or in a field. But nothing ever really clicked until I was in residency. And in our residency program, there was a residency research track called the B.H. Robbins Scholars Program. And it was something I knew that was there, but never would have applied to because I thought it didn't apply to me at all. I barely had any research experience. But as I was there, it became really clear to me that I had all of these questions about what was happening to patients after they left the hospital or after they left my operating room, how they were recovering, how the care that we provided impacted that. And so I started to have some conversations with different folks and ended up knocking on the door of Chris Hughes, who was the program director for critical care fellowship at the time. And he quickly became my mentor, and he connected me into his mentor and into the broader research group that I've been working with, the Critical Illness Brain Dysfunction Survivorship Center. And they said, if you really want to take a run at this, it's its own special skill set. So let's talk about getting you into the B.H. Robbins program. And so I was sort of a late entry, mid-residency into that. And through that program was able to have dedicated research time and start projects and work alongside them to understand how to perform clinical trials. Which then led to me being able to get some additional internal mentored research funding and the time to get a master's in clinical investigation and just really build up that skill set of how to perform clinical investigations. And then along with that, kind of going along with my interest in trying to understand the factors that allow people to recover or not, I would spend a lot of time just talking about that shared mutual interest with my then program director of residency, who eventually would go on to start our preoperative optimization clinic and to really be a pioneer in a lot of ways in this area of expanding preoperative evaluation into this optimization space. And the opportunity presented itself to take over as the medical director when he decided to pursue different opportunities. And so that's been a very interesting learning curve for me kind of earlier in my career. than I would have anticipated. But it's been a great opportunity to see the real-time application of a lot of the clinical medicine alongside or right in that realm of the research that I do. And so it's been an amazing journey, and I can't wait to see where the rest of it goes. And then, of course, as you mentioned along the way, have taken the time to have two, soon to be three children. And that is its own kind of part of the marathon, part of the journey. But I've been very fortunate to have overwhelming support from my mentors in my institution to be able to kind of move through all of these activities.
It's an incredible story. I think one thing that stands out from your journey is just this, sort of explosion of opportunity at this stage in your career with all of the groundwork that you laid. And I'm wondering if you can speak a little bit to factors that have helped you to achieve sort of balance and prioritization amidst all of the things that you have going on, not only professionally with these new clinical opportunities, with your basic science research, and then with your life outside of this, which is an incredibly important part of your story.
So I won't say that I'm the greatest at keeping that balance. But I think early on, somebody gave me the advice, which was actually a quote by Nora Roberts, the romance novelist, but she said that life is all about juggling balls, but there are glass balls and there are plastic balls, and you have to know which ones are glass because those are the ones you protect ferociously, and you're going to drop some of the plastic balls. And I think, learning to be able to set that prioritization. And then I recognized at some point that that was going to be a major issue for me. And so I formed a peer mentorship with one of my colleagues here who is also an early scientist, and we meet at 9:15 every Monday morning, and we have a spreadsheet with all of the things that we have going on, the projects we have going on. We set 6-month priorities, and we kind of list out in order what we're going to tackle that week based on our time available. Because I learned along the way that I'm an external processor. And so having someone to talk through that with and be able to say, here's what we need to focus on. And then I also regularly check in with my mentors to be able to establish those priorities. And it's also, forced me to be realistic about my time. And I heard again somewhere along the way at a Women in Anesthesia meeting that someone was talking about getting things done with a certain amount of time. And I actually think it was Liz Whitlock who said, I have an hour for this activity today. That's the time I have to get it done. And just recognizing that you can't dedicate endless hours and, don't let the perfect be the enemy of the good. At some point, you have to check the box and move on.
Thank you so much. I think that's talking about realism is especially helpful. I think coming from someone who, as yourself, who on paper just looks like potentially would never have had to sort of compromise on the perfect ideal of, scientific achievement just based on a resume alone. It's always so, I think, reassuring to hear kind of those real life experiences described in your own words. And I also really appreciate that you highlighted this idea of parallel mentorship coming from a peer. I think that's a different model than oftentimes we think of seeking out mentorship, which is maybe equally important, but just different from, mentors at much later career stages where potentially it's not quite as relatable to what you're going through in the moment. And so I'll ask too if you can highlight maybe a key example of mentorship or sponsorship in a little bit more detail that you feel has really made an impact on your career.
Yeah, so I think my primary mentor, Chris Hughes, has really been that person for me, in that he has really both helped propel me forward, but helped me overcome my own imposter syndrome by combining mentorship and sponsorship. So he's always there to answer my questions and help me set up the next steps. And he's very forward vision thinking. So he kind of outlines, here are the things that we need to be working on and thinking about and moving towards. But then also I've been very fortunate that he and his mentor, Pratik Pandharapande and Wes Ely through the SIB Center and others have just put me in the room. Because it's hard to put yourself out there. I think both as a woman, but also it's just kind of sometimes hard to break into certain spaces. But to have Chris say, you know, I appreciate you offering me this opportunity, but I have this fantastic mentee who is, you know, really becoming a leader in this space and has promoted me forward in that way. Even my involvement with ESAS, I was former co-president. That started with one of my sort of friends and mentors taking me to an ESAS meeting at IARS one year and saying, hey, I have this job as a regional representative. I want you to take it because you need to be involved in this organization, and just really pushing me to do that. So making sure that, you know, other people knew that I was in the room and trusted what I had to say has been really critical. And, you know, they of course had taken the time to get to know me and knew that we shared that interest in those areas. And I think, kind of like Dr. Orser mentioned earlier, you know, just being able to be there and work alongside them and to be able to put that investment into your kind of shared goal, then they in turn have always been there to kind of propel me forward and say, no, she's the real deal. You should listen to this. And that's been key for me.
Thank you so much. Thank you for sharing your journey and all of those, you know, words of wisdom from your stage of career. We really appreciate it. I'll go ahead and share the slides again, and we will hear from our next panelist. Our next panelist is Dr. Rebecca Minehart. Dr. Minehart is an associate professor of anesthesiology at the Alpert School of Medicine at Brown University. She serves as a vice chair of faculty development and the division chief of obstetric anesthesia at Brown University Health in Providence. She completed her medical school and residency at the University of Michigan, went on to obstetric anesthesia fellowship at the Brigham in Boston, and then became faculty at Harvard Medical School and Massachusetts General Hospital for nearly 2 decades. While she was there, she established the ACGME accredited obstetric anesthesia fellowship, and also served as the division chief for obstetric anesthesiology and perinatology. In a clinical academic environment, she has served as the associate editor for the patient safety section of Anesthesia and Analgesia. She also has established a body of work improving outcomes for teams through better communication and organization, especially during crisis scenarios. She's received multiple distinguished awards throughout her career, including the FAIR Research and Education Grant and the SOAP Teacher of the Year Award. In her outside life, she is a devoted wife and mother to 2 teenagers, as well as a stepmother to 2 other teenagers. She loves to travel and is beginning her journey as a kayaker. So Dr. Minehart will take a moment to hear, if you would, about your path to academic leadership.
Thank you so much. And it's such an honor to be with this distinguished group. I was really struck by how many parallels I was hearing in both Dr. Orser's and Dr. Rengel's journeys. And so I just wanted to highlight a couple of those because it was very heartwarming to me. The first was that my earliest mentorship was as a high school student. Where I had an amazing science teacher who said, you're really good with people and you're really good in science. So you should either be a teacher or a doctor. And I was like, I think I'll choose doctor. So I came at it from a very unsophisticated point of view, not having any medical people in my family at all. And so, found myself in an amazing environment in college and was able to get to medical school and had a late entry into anesthesiology, which was, once I found it, I was just in love with the work that people were doing. So came to OB Anesthesia Fellowship. And during that time, I hadn't had a lot of exposure to research, hadn't had a lot of opportunities. And so was really, but as I met Dr. Mapian Smith, who's at MGH and was doing work and speaking up, it was like life-changing for me listening to her talk about this work. And I realized I had to learn more about it because I too suffer from imposter syndrome. I too was noticing that I was having trouble speaking up and being present and filling a room too. So through that work, I started, becoming involved in her research through her gracious, invitation. And she became a very important mentor and friend to me, as well as a sponsor. One of the earliest exposures to the simulation community where she was devoting her research, or where she was conducting her research, was at the Center for Medical Simulation. And that group of people launched my career in an incredibly pivotal way by inviting me to write this FAIR grant with them. I mean, I was barely out of residency and fellowship, and this opportunity was just remarkable for giving me purpose and also protecting time in a very vulnerable point of career, which was as a young mother, as a new faculty member, trying to navigate my way through all those different things. And so through that too, my imposter syndrome propelled me to try to understand better research methodology, and especially in educational research, which is a little bit I mean, all research is very challenging, don't get me wrong. Educational research gets contamination like nothing else. So with people talking to each other and all those things. So I tried to develop myself and then develop myself as an educator as well. And during that was able to benefit from coaching through programs in the institution, and also by undergoing coaching training myself. And that has been a huge I think that has really influenced my leadership style as well, very much. In the simulation community, they've always been very engaging and supportive. And running a program there at the Center for Medical Simulation, I was able to practice and research, sort of like first-person research, using first-person research to develop a leadership style that I thought was the most effective in times of crisis. And it turns out that it's helpful in other situations as well. And then, you know, along the way, I had amazing people guiding me all throughout. Essentially, then I became interested in clinical leadership, and with the division chief positions that I've been able to have, it's just amazing. Like here at Women and Infants, we deliver, you know, 9,000 deliveries a year. It's 85 to 90% of the state of Rhode Island. So the impact that you can have, or one person can have, on lives of a whole community has been really remarkable to me. And it just fills me with purpose like nothing else. I think what I was thinking about when you were posing, when I was thinking about what I was going to say for this panel, the biggest things I felt were that sense of authenticity. I learned how to be an authentic person through my mentors at early mentors, especially at MGH, where, you know, really sitting down with somebody, learning about them, hearing their stories, connecting with them, and all that they bring to any kind of interaction. That, I think, has really fueled my development as a leader and my leadership style, because I feel like through that community building, we just, you know, we can honor all the different things that everybody brings to the table. So that has been really foundational to my way I mentor others as well.
Thank you. I think it's so inspiring to hear in this theme of authenticity, how your passion for clinical leadership led to your interest in research methodology and kind of informed your development as an academic in clinical education. I think that's an amazing path. Thank you for sharing. I really appreciate you too touching on this theme of imposter syndrome that I think, you know, is just so prevalent. And you know, as a kind of unique presence in just your trajectory in clinical leadership, when you think about women at the early stages of their career who have identified an interest in clinical leadership but struggle with this tension between sort of, be it imposter syndrome or just kind of newness with respect to their clinical role, how do you balance that, or what advice do you have for them to balance that with advocacy and sort of self-promotion and these things that we've identified, you know, through the literature as strategies for success?
Yeah, I mean, I think that's a really challenging situation, because I really love the idea of the humble leader. And yet, in our environments that are both collaborative and also very competitive, humility sometimes doesn't resonate with others. And so I think that there is some sort of a balance to do to thread with that. I think finding people who can be supportive and do that sponsorship makes an enormous difference. Just as Dr. Rengel said, like, if you have somebody who's saying like, okay, this is a great suggestion, let's hear what Rebecca has to say, or Dr. Minehart has to say, there's nothing like that feeling, especially early on. And so I think balancing that, finding the right people by asking a lot of questions, showing up observing a lot of people. How do they act and how do they treat others? And are they kind? Are they generous? Are they not? You know, how does that look in real life? Choosing those people, asking for their advice. Nobody likes anything more than talking about themselves. So engaging with them, showing enthusiasm for what they're doing if it resonates with you. And then I think sometimes just bravery. It needs to, people need to be brave and put themselves out there. I had a rule later on when I was the only woman in a room full of men, consistently in the clinical setting for leadership, where I would just promise myself that I would make sure to say something intelligent every meeting. I was going to have my voice be heard. I was going to be present every time. And I think that that's a hard thing to do, but listening really carefully and being thoughtful, I think if you can bring something to say each time, I think it helps people see you. And that's, again, promoting that self-advocacy as well.
Thank you so much. And I'll close with one question that's parallel to a question I asked to Dr. Orser, which is for women that you see, at the higher levels of academic leadership, what are there particular themes, strategies, or roles that they've played that you find particularly effective for mentoring young women and really advocating for women at earlier stages of the pipeline?
I love this idea that that people really try to create opportunities for others, and so other people have bestowed, invitations to me to speak and those kinds of things. I created my own programs here so that I can give grand rounds opportunities to many people, and they happen to be like 90% women. So I think those kinds of behaviors really are so important, and I think that people who came before me, the leaders, the cohort of women who came before me, I believe they had such huge mountains to climb. And I feel like they have made changes that make it easier for us to talk about family, for example, and the other challenges that we face. And so I think people who allow space for those kinds of conversations and that reality is so important, and it really is normalizing. You can have everything, you just can't have it all at the same time. I think that's much of what we've all been saying, and sort of giving nod to that your career might look a little different, but yet it still may be just as wonderful and enriching as anyone else's. I think that's an important message.
Thank you so much. It was really wonderful to hear your perspective. I will share our slides to introduce our last panelist. Our last panelist is Dr. Katarina Ruscic. Dr. Ruscic is an anesthesiologist and intensivist at Massachusetts General Hospital and an assistant professor at Harvard Medical School. She also serves as the director of the Plastic, Reconstructive, and Breast Oncology surgical program within the anesthesia division. She studied at the Medical Scientist Training Program at the University of Chicago, where she received an MD and a PhD in computational neuroscience. Her current research focuses on lymphatic cell biology and molecular mechanisms of lymphatic cell contractility, with applications to the development of lymphedema in critical illness. Dr. Ruscic has received multiple competitive funding awards, including the IARS Mentored Research Award in 2023, along with other distinctions, including the Harvard Medical School Eleanor and Miles Shore Faculty Development Award. In her outside life, she is a devoted mother of two and stepmother to a college-age child. She loves to walk and walks 6 miles a day in addition to weightlifting. She is a perpetual fashionista, passionate about design, and truly passionate about science, a passion that she shares with her husband. So Dr. Ruscic, I will stop sharing here and just invite you to share some words about your journey and career path.
Thank you so much. I loved some of the themes that have already come up about nonlinear paths. But first, a big thank you to you, Dr. Ranjeva, or if I can call you Sylvia on a personal note, for this invitation, to the IARS for this opportunity, and also for the IARS for the IMRA Award, of which I was a recipient a few years ago. So nonlinear paths, I think one personal anecdote I can share about that is recently I live in a small condo in Boston. I was trying to clear out space, and so I had to get rid of some old things, including a collection of old cosmetics from 2010. which I had hung on to because at that time in 2010, it meant a lot to me. I could barely afford it. It was expensive, and it was a little bit of war paint, if you would call it. And I found that I was recently able to let go of it, because if the 2010 version of me knew where I would be 15 years later, I think she would have been pleased and surprised. So I felt like I could let go of that because, it served its purpose, and I became what I was trying to become, and maybe even took myself by a little bit of surprise in becoming more. But I wouldn't have guessed then that I would be an anesthesiologist studying lymphatic biology. So my path is, in addition to MD, I have a PhD in ion channel biophysics. Then I found a love of anesthesiology, came to MGH for anesthesia residency, critical care fellowship. And towards the end of my training, I knew I wanted to do clinical research, but also get back into the lab and reconnect with my love for basic science. But I didn't really know, what I was interested in. And I became very passionate about lymphatics by seeing a lot of weird edema in the ICU and feeling like the things we think about with the heart and the kidneys didn't explain the whole picture. And there was probably this whole component of the lymphatic system that we were missing. And that has now become this whole research trajectory for me that I couldn't have predicted I would have fallen into. So that is kind of scientifically what I spend 70% of my time doing. I'm also a clinician. And then I have this leadership role, which I also wouldn't have necessarily expected to have 15 years ago. And that's something where a little bit of unexpected coaching, I think, helped me find myself in that role. So there was this like one-off program at MGH where physicians had an opportunity to sign up for a few sessions with a professional physician coach. And I signed up for it thinking, well, I probably can't do any harm. And I was a brand new attending, and there was a handful of leadership roles opening up in the department. And I remember talking to my coach and posing the problem to her as, well, I'm super junior and too junior to do all this cool stuff that's an opportunity now. So tell me what strategies I can put in place so that like 10 years from now, Katarina might have a shot at something like this when it comes up again 10 years from now. And she looked at me and said, well, why wouldn't you just apply now? And it was in the back of my mind, but I was like, nah, I'm too junior. It's not going to work out. And it was just really great having somebody impartial look at my CV and credentials and say, well, why not you now? Just try, see what happens. And in that leadership role, on the theme of authenticity, I found a way to turn it into something meaningful to me. So the services that I managed didn't particularly have a lot of like operations or clinical issues, but there was so much opportunity to do collaborative multidisciplinary research. Research is a strength of mine, so that's what I brought to that role, and did a lot of research across the drapes. And another thing I'm very passionate about is mentorship. So I tried to make those research opportunities as little nuggets where I could give opportunities for residents to be the first author, or undergraduates that I'm mentoring, or medical students to be middle authors, and sort of have all boats rise together. So that is sort of where I'm going with my path right now. In terms of the question of female specific issues along the way, ooh, hard to filter there and where to get started. So some thoughts there. Some things are overt, where something is said to your face and you're like, oh, that was definitely because something about appearance or being female, for sure. And then there's a lot of, I think Dr. Orser called it death by a million cuts, where you're not sure. Was it? Wasn't it? Was everybody dissed this same way? And so one of the things I'm finding is that while there are statistically proven systemic issues that we have to chip away at, on the individual Katarina making the best of her day level, it's not always helpful for me to think of it through that lens, or else I would start to get go crazy and be angry. And sometimes it's not even a female thing. One thing I totally thought was a female thing, I asked somebody else, I'm like, did this guy do the same thing to you? And like a bunch of men said he did that to them too. So sometimes you don't know. So I'm finding that focusing on the positive is always the best way forward, and reconnecting with the passion of why am I doing this? Why am I staying up late or spending my time, away from the other things that are important to me in life to write this grant proposal or put together this or put together that. And I come back to the core things that make me so excited, which is developing lymphatic medicine. It doesn't exist. We need these lymphatic activators. We need this lymphatic imaging in the hands of clinicians. I want to look up my patients and do best care possible for them as an anesthesiologist in the morning. I want to create these opportunities for my mentees. And I find that if I focus on these passionate things that flip the energy to the positive, I'm more able to ignore some of this noise of, oh, how and why and in what format was I discriminated against?
Thank you so much. There are so many just amazing themes in the story that you've shared. This theme of authenticity, I'm just floored by the way that's come out through all of your stories. But one thing I really appreciated was the way that you've had, as you mentioned, these unexpected nonlinear opportunities, and you found ways to sort of insert your core passions into each of those opportunities, maybe in unexpected ways. I think that's amazing. The other thing I really appreciate is your emphasis on the positive. It's something I think Dr. Orser echoed as well, that in a world where we see these statistics where it can feel so overwhelming with respect to kind of identified disparities, that we actually do have agency to positively impact our own experience, to remain adaptable, and we can make the choice to remain, focused on our passions. And I just think that's such an empowering sentiment that I've heard from all of you. So I really appreciate that. Thank you for sharing. I'll ask you just kind of if there is one particular or a notable experience of either sponsorship or mentorship that you can share from your personal experience that you think was particularly impactful.
I am so grateful to have had many, many amazing mentors along the way. And without that kind of mentorship, I think it would be very hard to be where I am now. And a very special early stage mentor when I was 18 was in undergraduate, my very first research experience. It's what I would call like a leap of faith and credit, where I matched into this research program, and the head of that lab had this algorithm of how he mentored people and what opportunities he created for his mentees. And so before I even set foot in the door but had committed to do this program, he submitted our research abstract to a conference that was happening that summer. So my name was already, like somewhere fourth, fifth author, but I was on it and I was going to go to the conference and present with the team. And that leap of faith, I mean, gosh, that's some of the hardest I've ever worked, was that summer to then merit, which now is such a crumb, little, middle authorship on an abstract at a conference. But when you're an undergrad, that's such a huge thing. And that then snowballed into so many other opportunities. And then the hard work I put in that summer turned into papers and patents and all this stuff. So that stays with me as a very special mentorship opportunity, and one that I've also learned from as now somebody who mentors people, what takeaway things that's going to stay with mentees and end up on their CV forever can I give to them? If they're already making the time to show up, I don't want them to just write on their CV, I hung out with her for a while. Like, they need something to take away that will live on their CV forever. So I think because of that very first opportunity when I was 18 years old, that's really shaped. I try to do that as much as I can for other people. And I've certainly had many, many wonderful mentors since then, but I think that was such an early career win. And another thought I have is with this whole mentor sponsor stories, everyone's path is unique and everyone's trying to get to someplace very different. So I've really only recently realized at some point, no one's really doing exactly what you want to do. And so at some point, there's no person that you can exactly shape yourself after. And you realize you're kind of this hybrid of 10 other things. And so I have now tried to make it a habit of reaching out to those 10 people and trying to pick their brain. And some of them will be too busy to talk to. Some will give great advice. Some will turn into mentors. Some will turn into sponsors. And you can't always predict who's going to end up being able to do what role. And another thing is not always expecting a mentor to be a sponsor, because they may not have the connection you need, but they can help you realize what's the thing that you need next. And I've learned to start being proactive about asking for sponsorship. So, the advice is, okay, you need this next thing to succeed. Well, rather than just waiting around for it to happen, be a little bit, as Dr. Minehart said, brave, and reach out to the person who can make that thing happen and say, like, hey, humble request, but what do you think about, blah, blah, blah? And do you think I might be a good candidate for blah? Or can you propose me for blah? And sometimes it doesn't work out, but sometimes it does. So that's what I'm learning now as an early stage person.
Thank you so much. And I think one really important theme that you've highlighted there is similar to what Dr. Rengel mentioned, of like the people that just get you in the room, and then you will take that opportunity and run with it. It seems like that's had a huge impact on you. And I think it's so inspiring that you're so passionate about giving that to trainees that you work with now. So thank you so much for sharing. That was an incredible set of perspectives from our panelists. Some of the themes of just authenticity, being kind to yourself, recognizing that following your pure passions will lead to the professional success that you want, and some just great examples of kind of putting yourself in the room, participating actively in your own mentorship. I think is such an inspiring example from all of you for everyone on this panel. So we're so grateful to our panelists. We'll have time for a few questions from the audience now. I'll address our first question to Dr. Orser because I believe she has a quite important commitment at 5 o'clock, so we'll get the first question to her. This is a question from one of our audience members, reflecting on the phase of life when children and family were a high priority for you, and that was challenging to balance with your career at the time. Do you have tips for keeping professional doors open for future involvement while having to say no to some opportunities? I think you are possibly still muted, Dr. Orser. Thank you.
Thank you. Sorry. That's a tricky time of life when you've got so many responsibilities and things that only you can do that demand your time and attention. So it is tricky. I think my view was keep a baseline level of activity going. And so trundle along at the pace that you can maintain comfortably. It's like marathon running. You just keep it going. I'm always the walking wounded at the back on those races, but I keep on going. It's kind of an analogy to my career. Just keep on keeping on. But look for those opportunities, contribute when you can. Just keep it up. But be very careful about how you pace yourself, because you've got to, there again, come back to your priorities and figure out how you're going to manage all those challenges. Don't find yourself overwhelmed. Recognize those challenges as opportunities for growth. And you can say to yourself, am I ready to grow? Am I ready to tackle this one right now? Or do I need to park it? It's okay. Be confident and appreciate what you are contributing. You're never going to do it all. Just keep that steady pace, because there will be time for you to tackle some bigger things, but just see everything as an opportunity to grow, change, become a better leader. Yeah.
Thank you so much. And thank you, Dr. Orser, for sharing all of your perspective on this panel. We really appreciate your time. Thank you so much.
My pleasure.
Another question is for Dr. Rengel. Dr. Rengel, how do you structure and use your personal project tracking spreadsheet to guide sponsorship and mentorship conversations, prioritize tasks, and adapt it for busy clinical or private sector settings?
Yeah, that's a great question. I think all of us have potentially a habit of overcommitting and not realizing maybe just how many things we have committed to. And so keeping them all in one central location helps me. And then I put in a policy with my mentor that I don't say yes to anything until he says yes to it. Or at least we have talked about it. So in my eagerness to want to stay involved and to participate, it gives me a pause to say, does this really align with all of my goals right now? And then it has sort of a category where I star off things that are 6-month priorities, 1-year priorities, to make sure that things are aligning. Because I think it's very hard to let go of what feels like an opportunity early in your career, but it can really take time away from other things. And then it also helps give me some clarity as I look at my week. Like, what did I really enjoy spending my time doing, or what did I really not like doing? And then I can have a very frank conversation with my mentor, who then can help tailor his guidance, but also, where we invest our energy in seeking sponsorship, and which rooms you try to sit in, because you can't sit in all of them at the same time. And so I think it's both a dose of reality and realism, and also clarifying for me personally.
Thank you for sharing that. I very much appreciated. Another question, sort of on a personal note from an attendee, is, has anyone in this incredible group of speakers been able to succeed with a disabled spouse, as a single mother, or with a child with special needs? Dr. Minehart, I think if you wouldn't, if based on our emails, I think maybe we could shed some really helpful perspective in this area,
sure.
only if you're comfortable.
Of course. So I have 2 biological children, and one had a very late diagnosis of autism at 16 years old. And that was coinciding with a career change and a divorce, and so many different things. And it is really, really, really challenging. And I think that I was given advice by another strong woman leader who was amazing. She said, clear your schedule for a year and don't expect anything of yourself. I think that having compassion with myself and getting through that time. I mean, we did a hospitalization. It was multiple, like, different school changes. It was incredibly stressful. And so I think that giving yourself grace and I love that that analogy, or that quote that Dr. Rengel gave about juggling balls, and some are glass and some are plastic. And I just feel like that is exactly trying to identify which ones of those are the ones to protect is super important. There's a book, just really quick, there's a book called How Will You Measure Your Life by Clayton Christensen that I read early on, and that helped me also sort of put things in perspective too. Career is amazing and fulfilling, and your family is impacted too. And so thinking about it holistically is a reality as well. So good luck to you.
Thank you so much for both the audience member that asked that question, and for you, Dr. Minehart, for being so vulnerable. These are really important issues, and I think just seeing that vulnerability is really inspiring. Thank you so much for those words of wisdom. There's actually another question for you, Dr. Minehart, from one of your former mentees in the audience, Courtney Maxey. I just wanted to say hi to Dr. Minehart, who was a great example for me when I was a resident at MGH. My question is, any recommendations for managing other members of healthcare and how they respond to female physicians? My male physician colleagues are rarely the ones who make it apparent that I am a woman. Rather, it is the administrators, nurses, etc., who address men as doctor, but me as Courtney, and many other subtleties along the way.
Yeah, I just think that this kind of level of microaggressions is really prevalent and pervasive and very, very challenging. And I think it does need to be addressed through leadership. I think especially thinking about the social like the social leadership level of how the nurses, how they might interact with each other, and whether they take direction from their leaders or not is possibly a way to go. At MGH, we had this issue come up, and there was a female colleague who really felt like she wanted to be addressed as doctor, and it went out through an email and caused a lot of consternation too. So I think it's very challenging when it's just directed at a woman physician, and so needs to be handled, I think, through face-to-face conversations, at least at first, and probably with leadership, because it's not okay. I think I'm sorry that that's happening.
Thank you for speaking on that. I think, even and to, our audience and people who have a similar question, I think that's such a pervasive experience. And even when it doesn't come from malicious intent, these sort of systemic barriers do exist. So I just really appreciate the candidness with which all of our panelists and our audience are sort of recognizing that. We'll move on to another question, which is how can we design a cross-sector sponsorship program that connects private sector women leaders in low and middle income countries with academic mentors to foster collaboration and leader development? So essentially asking, how can we create links between sort of academic medicine and sort of the world outside of academic medicine, especially in, countries outside of the United States?
I think this is certainly a very challenging question, and I do think that organizations like IARS have been really thinking about this a lot, and I think are a great opportunity because I think some of these things, when they do happen, grow sort of organically, like I have a connection at this one institution or that one institution. And I've seen examples of that in medicine. But I think that, kind of trying to raise this question to groups like IARS, where there are concentrated groups of both leaders and of, potential mentees. And I know there has been some work in creating things like mentorship, matching, algorithms and databases and some different leadership type programs. But I definitely agree. And I think there was also a question that came up in the chat about if there are no adequate mentors where you are, how can you succeed? I do think that being able to reach outside of your own institution and use the wide availability of just connecting virtually is going to be the best next step to be able to address that. And it is certainly a big challenge that I don't think we have a great answer to, but taking kind of one step at a time.
Thank you so much. And thanks for drawing from your experience at, a high organizational level with ESAS as well. And thank you for that insightful question from the chat. Our next question is about DEI standards for search committees. This question from the audience, are there DEI standards for search committees for leadership positions? I'm often the only woman on the international and national committee. It's biased from the start. Similarly, how can we engage in women to apply for leadership positions? I'm surprised at all the men who apply, but not the women who are potentially very qualified, but choose to not step up. So essentially, how can we promote, more self-advocacy from women when it seems that this is happening at comparable rates from male counterparts?
I mean, I can say that I think we had many searches recently at MGH when I just came from there not too long ago. And I feel like one of the things I think senior leadership should do, if you happen to be in a leadership position, I think we should all be doing this, is to sort of go individually to people and encourage them to apply. Again, that invitation is so important for people to feel legitimate at implying. And I hate to sound very gendered, but there is a statement that I use with my sister, which is, what would a man do? Would a man worry about these things? No, then you should just go for it. So I think that setting the field, sort of out there and saying, like, how can we just accept that other people will be boldly confident, may or may not have the exact skill set needed for the job. Why don't you just try and see where it takes you? And if it doesn't work out, you can come cry to me and we will cry together. But I do think that senior leaders, if you can invite people, promote them to go, I think it does make a huge difference. If you're starting to apply, seeing that as an opportunity just to get your name out there, also reframing it to make it not so high stakes could be helpful.
Thanks so much. And I think, your very eloquent answer also draws on a theme that Dr. Ruscic brought up, which, this question of why not me? I think that's something that, we don't ask ourselves enough. And I really loved that question that came up during Dr. Ruscic's presentation as well, but both really, really excellent perspective to give there. So thanks, Dr. Minehart. And thank you for that question. Our next question, we'll do a couple more questions here, and then I want to be mindful of everyone's time as well. Our next question is asking about dual career spouses in academic medicine. Do any panelists have spouses in academic medicine? And if so, how do you handle dual careers? Insights, either positive or negative, would be of interest.
I can give one answer. So my husband is not in medicine, but he's a scientist. And he has a lab at Northeastern, so dual academic careers. And yeah, we joke all the time about how we for sure can't move anywhere because that would just be way too hard to reset up everybody's life. So I guess my answer is really more just one of empathy, that I am in that situation, and I acknowledge that should I find myself in a situation where I would like to move, I think that would be very challenging. Yeah. But not impossible.
Thanks. I think, yeah, definitely highlighting sort of geographic constraints with two specialized scientific foci is definitely, I think, something that is a common experience for all of that. So thank you for that perspective. I think definitely the geographic search is one of the most major themes that comes out of that discussion. Just a few more questions here in the chat. One is, thank you very much for your candid stories and advocacy for women. I have two questions. One, you talked a lot about mentorship and touched on sponsorship. I wonder if you could speak to increasing sponsorship for early career women. Are there mechanisms that you've used or can suggest to encourage sponsorship as opposed to mentorship in some other way? Second question being, I heard a few comments about coaching. Do you think that coaching might be a good way to encourage and support women in leadership as well as women considering leadership? And do you think everyone should have a coach, particularly women?
I can take part of this question. I also want to hear what Dr. Ruscic has to say about the coaching, but for the first part about the sort of programmatic ways to attain sponsorship, I noticed that I became an ABA board examiner, and that's maybe not an early stage career opportunity, but when I went to the boards and examined for the first time, they had a women's group. And in that women's group, I was so struck by people offering, what do you need for your career? Can I get you to come to my institution and give a grand rounds? Like, what can I do for you? If you need a letter of recommendation to get a promotions, please tap on me. And I think that this is, it was such a striking and beautiful thing for me. I thought that this is like what we should be doing more. And so I do think that it may not be the path that everybody goes to become a board examiner and then fall into this group, but thinking about professional societies and the ways that they try to have women promoted, like IARS, I think people who are interested and engaged in these things and have the means will show up to these different organizations, and they will offer sponsorship opportunities. So I think, building it through just doing, I think might be one of the ways. I don't know if the other panelists have another idea about that, but for the coaching thing, I think coaching is essential. I too had the 6 episodes with the coach, and then I stayed on with her for 2 years because I thought I can't not have a coach, because just the professional development that she gave me, the insights she gave me was just phenomenal. So I definitely think that if you have an opportunity, it's really worth investing. It's really investment in yourself. Absolutely.
I would weigh in and say I also found the professional coaching very helpful. I ended up doing something around 10 sessions, and then it was quite pricey, so I decided to let go of it. But I found that even with a limited number of sessions, there was definitely some very important neuronal rewiring that I think happened for me in terms of framing things, navigating situations, dealing with disappointment in a different way. So I think it depends on finding a coach that you really clicked with. This was specifically a physician coach. She was a physician and she coached specifically physicians, and something about it did really work for me. But I found that sort of like a limited dose was enough to create some change that I think was helpful.
Thank you both so much for highlighting that and for just kind of highlighting this use of, structures that are in place to like help us with all of these issues, at the beginning stages of our careers. It can be really helpful to engage in our resources. We'll move on to our final two questions in the chat. Our next question from the audience. Thank you all for sharing your journeys. You inspire us to be great. How many minority women across have access to similar career opportunities? And do you have any sense from this in your own pathways? Many of us have had no early career mentors and are only realizing this deficit later in our career. Thank you so much to whoever asked this question.
I think that this is a big gap, and I think we need to urgently seek out people who may not have the same opportunities as in the minority groups to try to help sponsor them, mentor them, connect them with others who are maybe at different institutions even, who are prominent figures. I think it's just it's really difficult if you're feeling isolated and you don't feel like you have somebody you identify with, and especially who shares some very similar background experiences or cultural experiences, all of those things. I think that's really powerful and important to building trust, and then to be able to trust that the person will help shepherd you through a career. And so I think continuing to develop people and make these connections, I think we all urgently need to be working on this.
Thank you. And yeah, thank you for highlighting what an urgent need it is to address this issue. And thank you so much to the person who asked this question for highlighting that particular disparity for minority women. Thanks for engaging in this conversation with us. And then our last question comes from a very early stage clinician in our audience. What advice do you have about finding a supportive residency program? This is from a current medical student in MS4 applying into anesthesia who is a full-time single mother to an almost 3-year-old.
I think that my advice really to anyone applying to residency, but is to, and I know that it's so hard, back in my day, we got to go in person and interview at residencies. And I think that makes it more challenging. But finding programs that have residents in similar situations, or just kind of asking around, but I think you'll find that to be maybe more common than you think, depending on where you look. And oftentimes the residents and programs are very willing to connect you with a resident to talk to say, how has your experience been? How have you found support? How have you made this work? And so I think, I certainly chose my residency based on my interaction with the residents more so than almost anything. And I think that it's very telling, and you'll be able to see what really is possible by kind of getting some of that firsthand experience. Or maybe that's even trying to go to the ASA meet and greet and talk to some of the residents there, or trying to connect with the residents through social media avenues, or whatever the case may be. They're an excellent resource and often very open to talking.
Thank you for sharing that perspective, Dr. Rengel, and it's helpful to know that really informed your residency search as well. I think you all, as well, like our panelists today, have been an example of that in sort of the candor with which you've shared your personal experiences, some of the good and the bad, and how that shaped you. I think, as you're choosing any next stage in your career, you can, rely on people to, be candid with their experiences. And so definitely want to wish, all the best in your residency search to the person that asked this question. And also thank you for being here today and coming to this panel at this early stage in your career. that is our questions from the audience. I want to take another moment just to thank our panelists so much. You are all so inspiring, and it was just so helpful to hear both these connected themes through your shared experiences as well as your individual journeys. It's such an inspiration for the people coming after you, and we really appreciate your time. And also thank you so much to the IARS for allowing us to have this webinar.
Thank you so much for this gracious invitation and this opportunity. And thank you to the panelists. It's been amazing to see you and hear from you.
Yes, thank you all.
Thank you so much.